A bit of background, Northern Rivers. What is it? What are the services you provide for what people? Let's start there.
Good question. So Northern Rivers is one of the largest human service agencies upstate across. We're in some north of 40 counties across the state. We do mental health counseling. We do education. We do residential programming for kids who have to be placed in foster care or in mental health institutions. And then we do a significant amount of community-based mental health work for families and kids. Our kids, our profile is we serve kids as young as 6 weeks old in our early Head Start program, all the way to Medicaid and Medicare ages. So it's really 6 weeks to 67 years of age, primarily around mental health and recreation or residential care.
When you talk about the human services spectrum, where does it fit within the state, if you will? What kind of role does it play, in terms of the rest of what goes on in terms of the systems and the different areas that you address?
That's a really great question because there's really two answers. Human services is healthcare, mental health is healthcare, housing is healthcare, and the human service system is the safety net. We are the organizations that government contracts with for the care of young kids who are abused or adults who need acute care. And these are individuals who are the state's responsibility and they need to provide service. So we are that service network. We are that safety net, but it's fully integrated. If you don't have a place to sleep at night or your mental health is not perfect, then your healthcare is going to get impacted. And I think one of the things that we're saying this year is we need to better integrate the different systems. We are regulated by a number of state and federal agencies. The Office of Mental Health regulates our mental health program. Department of Health regulates our health program and our community-based services. The Office of Children and Family Services regulates and licenses our residential programs. And of course, state education supervises and looks after our schools, plus all the local laws and authorities that, have skin in the game, so to speak, to see how we're doing.
That's a lot of entities, for sure. And
it's a lot of bureaucracy in potential.
And that gets to my next question. You alluded to a bit there of what is the state right now of this sector and the work that you do? What's it look like?
I think on the best days, it's very fragmented and we have too many silos. On the worst day, we have real broken parts in the system, in part because we have a workforce crisis that has gotten increasingly worse since COVID. And if we don't have a workforce, we can't provide the needed services. And secondly, I think we've just become too siloed as a state in terms of delivering services. We have, overlapping requirements, but we don't operate like a business in terms of oversight.
You speak to in your op-ed in the Times Union. You speak one of the first sentences. You talk about fiscal headwinds, and I spoke to the budget director 2 weeks ago about what they're looking at, what they're dealing with, and there's a lot of different factors that go along with that. And obviously we talk a lot about these days funding cuts. That is something that we've seen in a variety of sectors, in a variety of ways, from a variety of places. You say, what if the answer isn't necessarily about spending more, but about spending smarter? Can you peel the layer back of what that means?
Exactly. So in addition to the funding cuts that certainly Director Washington talks about, there's also inflation. Cost of doing business goes up every day. And whether the president's numbers are true or not doesn't really matter. I know on the ground costs are going up, insurance, workforce, salaries, things like that. But I think we need to look at how we do our business, and we need to strip out those duplicative processes. We need to use things like AI to streamline the work we do that we no longer need perhaps an individual to do, allow them to perhaps do better clinical services instead of doing paperwork. We have a multi-billion-dollar human service system in this state. Just imagine if we could eliminate 2% of that through technology, through simplification, through focusing on outcomes instead of process. We could save hundreds of millions of dollars, for which we could reinvest in our system for our workforce and hopefully serve more individuals in a better way.
Yeah, how is it impacting the work you do on a daily basis? Is it getting in the way of doing more? Is it getting in the way of helping more people? What is that little ripple effect you could speak to?
The ripple effect impacts employees, because employees who get into the field, especially mental health, social work, and things like that, education, they don't come to do paperwork. They don't come to do duplicative processes. They come to focus on outcomes. So I think what happens is people get frustrated, burned out. They say, I didn't get into this business to push a lot of paper over and over and over again. And I think the other part is there's increased need. There are wait lists in virtually all the mental health programs across the state and in community-based programs. And so you've got a workforce that's disenfranchised some days or frustrated, and then you've got increasing needs. So, I mean, the collision of those two things leads to a very bad situation.
And obviously, you've sent out a list of proposals. If people want to peruse that, we'll have that a link for everybody to take a look there. In terms of cutting out the bureaucracy, what are some of the things that you think can help in addition to what you've already spoken to?
I think the one that strikes me is when you're in our field, you get licensed by the state education department, and that's totally appropriate. But we had an individual recently in April who passed their social work test, and they were ready to practice. She couldn't get her permit until October because the bureaucracy was too slow. That's incredible. I mean, we have automation. We have improved processes. We have smart people in state government. Let's figure out how to do it better. The other one that really strikes us is if you're a consumer of our service, be it mental health or recreation, it is likely that you will have 10 to 15 different assessments every time you go into a new program. It's a repetitive process where you're asking a client or a family to talk about their history over and over again. And usually that triggers trauma. And it doesn't help you get to a place where you can develop a good case plan. It simply documents the past. And I think the silos of our oversight agencies need to sit down together and say, how do we get a streamlined assessment? How do we get it done right the first time instead of just repeating it over and over? I mean, that's the theme in our paper. We repeat everything, thinking it's going to produce a different outcome, and it doesn't. The third piece, and it's one that certainly technology can help, is the clearance process for prospective employees. We want our employees to be cleared, and we want fingerprint checks, and we need child abuse records. But why is it every time that we hire someone to work in one program, we have to clear them a second time if they work in a different program? Or if you work at Northern Rivers and you want to get a part-time job at the Center for Disability Services, they have to re-clear the individual. I think there's something called technology that you can use to make that record portable. I mean, everyone knows where I drive with my Easy Pass. That's a system. Or if I get a traffic ticket in the city of Albany, everyone knows that. Why can't we apply the same technology and investments to make the process simpler, more streamlined, and less frustrated for the employee?
Some of the parts of this process, these regulations, this infrastructure that you could say is in place right now, obviously was put in there for a reason by these agencies. And some, what if people are concerned that say, well, cutting some of this out might remove safety oversight? What's your response to that?
We're not looking to reduce safety or compliance. We're looking to modernize. And what I say back is, let's get everyone in the room and figure out how to get to yes instead of starting with no. Too often we're told the federal requirements or the state requirements or the politics of the day always end up in no. We need to throw that paradigm and turn it upside down. We need to get to yes. We need to simplify the process, save money, and protect our community and protect our customers and our consumers.
Can you speak?
Quite frankly, I just think it's an excuse not to do something, to be blunt. This is the time, and this is the time to seize the moment here. We got looming federal cuts. We got demand by individuals across the state to do things differently. So let's take it on.
Finally, the targeted inflationary increase proposal in there, 2.7% is what I saw. Why?
Why? Because our workforce, unlike a lot of businesses, 70% of our costs are based on our worker salaries and benefits, caseworkers, clinicians, cooks, bus drivers, et cetera. We need to pay them so we can impact our retention rate. The human service sector historically has been underfunded. The common joke was you could make more money serving coffee at a fast food place than you could caring for a kid on second shift. The governor's made investment in the targeted human services cost of living increase over the last 3 years, and we thank her for that. We need to keep it going year to year to year. So the 2.7% is the consumer price index increase year over year. Not a number we made up. It's a number that the federal government calculates every year. So it's a modest increase, but it will allow us to give raises to our staff and pay for increased costs like health insurance and liability insurance.
Is there any legislation that's been proposed or talked about that aligns with any of this, either on the books or that has been?
We have not seen any legislation. That's why we're saying that we need a targeted increase, the 2.7%, but we want to offer some ideas on how to pay for it. So I think they should be coupled in the budget. As you know, the budget is a policy document as well as a financial document. So let's couple some of these ideas. Let's commission the division of the budget in the governor's office, pull together experts to make these changes. Some of it may take short-term funding. You know, automation isn't always is not free. But let's invest now to produce savings down the road.
Yeah, and finally, we'll talk that those savings and the taxpayer dollar. Obviously, we hear a lot about that these days. Where does that fall in all of this?
Uh, the state budget is made up of federal dollars, the state dollars, and then local government contributes. So if we can save money in the administrative processes, or we can reduce the number of days that kids are in foster care, the state and local government shares in those savings. And then equally important, we get better outcomes. Keeping kids in care too long is not the right thing to do. We can't keep kids forever. Let's find ways to reinvest residential savings into community-based services so we can get kids back home to with their families.